Theory and Practice of Counseling and Psychotherapy, 10th edition. Chapter 7, Person-Centered Therapy. Introduction. This approach emphasizes the following: personal characteristics of the therapist, quality of the therapeutic relationship, person's capacity for self-directed growth if involved in a therapeutic relationship. 4 periods of development of the approach. This approach challenges the following: the assumption that the counselor knows best, validity of advice, suggestion, persuasion, teaching, diagnosis, and interpretation, belief that clients cannot resolve their own problems without help. The first period, non-directive counseling, provided a powerful alternative to the directive and interpretive approaches. The second period, client-centered therapy, reflected emphasis on the client rather than non-directive methods. The third period addressed the necessary and sufficient conditions of therapy. The fourth phase, marked by considerable expansion of education, couples and families, industry, and groups. Emotion-focused therapy. Evidence-based approach developed by Leslie Greenberg, rooted in a person-centered philosophy but synthesizes aspects of Gestalt and existential therapies, emphasizes awareness, acceptance, and understanding of emotion and the visceral experience of emotion. Emotional change can be a primary pathway to cognitive and behavioral change. A range of experiential techniques are used to strengthen the self, regulate affect, and create new meaning. Emotion-focused therapy strategies help clients with too little emotion access their emotions and help clients who experience too much emotion contain their emotions. It is effective in treating anxiety, intimate partner violence, eating disorders, and trauma. Existentialism and Humanism tended to be confusing for students and theorists alike. Share a respect for the client's subjective experience and the uniqueness and individuality of each client. Emphasis is on concepts such as freedom, choice, values, personal responsibility, and meaning. Abraham Maslow's contributions to humanistic psychology. The positive psychology movement shares concepts on the healthy side of human existence with the humanistic approach. Core characteristics of self-actualizing people are self-awareness, freedom, basic honesty and caring, and trust and autonomy. Hierarchy of needs is a source of motivation, with the most basic needs being physiological needs. View of human nature. At their core, humans are trustworthy and positive. Humans are capable of making changes and living productive and effective lives. Humans innately gravitate towards self-actualization. Given the right growth-fostering conditions, individuals strive to move forward and fulfill their creative nature. Counselors' creation of a growth-promoting climate. The following are the 3 therapist attributes that create a growth-promoting climate: congruence, which is genuineness or realness; unconditional positive regard, which is acceptance and caring; accurate empathic understanding, which means the ability to deeply grasp the subjective world of another person. Clients' experience in therapy. Clients have the opportunity to explore their feelings, beliefs, behavior, and worldview. Client may hope to find the way through the guidance of the therapist. Therapy relationship provides a supportive structure within which clients' self-healing capacities are activated. Relationship between therapist and client. The following 6 conditions are necessary and sufficient for personality changes to occur. Number 1, 2 persons are in psychological contact. Number 2, the client, is experiencing incongruence. Third, The second person, the therapist, is congruent or integrated in the relationship. 4. The therapist experiences unconditional positive regard or real caring for the client. The therapist experiences empathy for the client's internal frame of reference and endeavors to communicate this to the client. Number 6. The communication to the client is, to a minimal degree, achieved. The therapist is invested in developing his or her own life experiences to deepen self-knowledge and move towards self-actualization. The therapist is genuine, integrated, and authentic. The therapist can openly express feelings and attitudes that are present in the relationship with the client. The therapist serves as a model of a human being struggling toward greater realness. Evolution of person-centered methods. Effective therapy requires therapists to be fully present and engaged with their clients. Being with clients and entering imaginatively into their world of perceptions and feelings. Listening, accepting, respecting, understanding, and responding must be honest expressions by the therapist. Immediacy, or addressing what is going on between the client and therapist, is highly valued. It is essential for therapists to adapt their therapeutic style to accommodate the unique needs of the clients. Person-centered approach work in diverse ways. The role of assessment focuses on the quality of the therapeutic relationship, engages in co-assessment with the client, and does not value traditional assessment and diagnosis. Clients are involved in a collaborative process in making decisions. Application of the philosophy of the person-centered approach. It emphasizes staying with clients as opposed to getting ahead of them with interpretations. It is straightforward and easy to comprehend, and they encourage locating power in the person. Demands a great deal of the therapist. Without a person-centered way of being, mere applications of skills is likely to be hollow. Application to crisis intervention. When people are in crisis, one of the first steps is to give them an opportunity to fully express themselves. Genuine support, caring, and non-possessive warmth can motivate people to do something to work through and resolve a crisis. Communicating a deep sense of understanding should always precede other problem-solving interventions. Application to group counseling. Therapist takes on the role of facilitator who creates a therapeutic environment. Techniques are not stressed. Exhibits deep trust of the group members. The responsibility for the direction of the group is on members who set the goals for the group. Provides support for members. The group setting fosters an open and accepting community where members can work on self-acceptance. Individuals learn that they do not have to experience the process of change alone. They grow from the support of group members. Principles of Expressive Arts Therapy. All people have an innate ability to be creative. The creative process is transformative and healing. The healing aspects include meditation, art, and music. Consciousness is achieved through self-discovery, self-awareness, and insight. Self-awareness, understanding, and insight are achieved by delving into our feelings of grief, anger, pain, fear, joy, and ecstasy. Feelings and emotions are an energy source. The expressive arts lead us into the unconscious. One art form stimulates and nurtures the other. A connection exists between our life force. The various art modes interrelate in what Natalie Rogers calls the creative connection. Creativity and offering stimulating experiences. Following are the conditions that foster creativity: acceptance of the individual, a non-judgmental setting, empathy, psychological freedom, stimulating and challenging experiences, Individuals who have experienced unsafe creative environments feel held back and may disengage from the creative processes. Art is not only for the few who develop a talent or master a medium. We can all use various art forms to facilitate self-expression and personal growth. Motivational interviewing. A humanistic, client-centered, psychosocial directive counseling approach developed by William R. Miller and Stephen Rolnick in the early 1980s. It's applied to many clinical problems, but was initially designed as a brief intervention for problem drinking. Both MI and person-centered practitioners believe in the client's abilities, strengths, resources, and competencies. MI spirit is deliberately directive and aimed at reducing client ambivalence about change and increasing intrinsic motivation. Honoring the MI spirit is essential. Assisting clients to become their own advocates for change and primary agents of change. Achieving successful outcomes as the specific theoretical model. The basic principles of motivational interviewing. Therapists strive to experience the world from the client's perspective without judgment or criticism. Evoke and explore both discrepancies and ambivalence. Reluctance to change is viewed an expected part of the therapeutic process. Therapists support clients' self-efficacy, strengthening clients' commitment to change and assist them in implementing a change plan. The stages of change: pre-contemplation stage, contemplation stage, preparation stage, action stage, maintenance stage. Strengths from a diversity perspective. Person-centered therapy has had a major impact on the field of human relations with diverse cultural groups. Carl Rogers' work has reached more than 30 countries, and his writings have been translated into 12 languages. The therapist is viewed as a fellow explorer who attempts to understand the client's phenomenological world in an interested, accepting, and open way. Shortcomings from a diversity perspective. Clients who expect a directive counselor may be put off by this unstructured approach. It is difficult to translate the core therapeutic conditions into actual practice in certain cultures. The focus on individual autonomy and personal growth may be viewed as selfish in cultures that stress the common good. Contributions of the person-centered approach. Natalie Rogers' use of nonverbal methods and expressive arts to enable individuals to heal and develop has expanded her father's pioneering work. Carl Rogers literally opened the field to research. The philosophy and principles of this approach permeate the practice of most therapists. Extensive research supports the effectiveness of person-centered therapy with a wide range of clients and problems of all age groups. Limitations and criticisms of the person-centered approach. Emphasizes the role of techniques aimed at bringing about change in clients' behavior. Therapeutic core conditions are necessary for therapy to succeed. The therapist's genuineness determines the power of the therapeutic relationship.